Hello friends, let us now learn some important points about the different lobes and the atelectatic changes in them. So before we go into different lobes of lung and atelectatic changes with them, changes seen in them, first and foremost we should see where the normal features are and how the normal lung can be divided into different lobes. So if you see here, this is the normal right lung, this is the left lung, right? So this is right lung, this is the left lung. Now the right lung, if you see, the right lung has two fissures, horizontal fissure and horizontal fissure, and we have oblique fissure. Whereas similarly the left lung has only one fissure, which is oblique fissure. It does not have horizontal fissure. So if you see here in this picture, this is the horizontal fissure. Right lung with horizontal fissure is this one. In the frontal view, this is the horizontal fissure. Similarly, in the anteroposterior or posterior-anterior view, if you see, this is the horizontal fissure. Sometimes in the chest X-ray, this horizontal fissure may appear as two lines like this, but this is also normal. Okay, next. If you see in the lateral X-ray, this is the horizontal fissure. Right lateral view, this is the horizontal fissure and this is the oblique fissure. Similarly, here this is right oblique because it is right lateral view. Here if you see, this is the left oblique fissure. Okay, and in this lateral view, you can see that this horizontal fissure may not be completely horizontal, perfectly horizontal. It might show like this with a step or undulation in between. There is a step or undulation in between. So these are the normal fissures which you can see. Then we have normal hilum. So if you see the normal hilum, if there is any collapse, one thing that happens is in collapse, the position of hilum alters. In any type of collapse, the position of hilum will alter. Because the position of hilum will alter, so it is better to know the actual position of hilum. So in all types of collapse, the position of hilum will alter except that in middle lobe collapse. In middle lobe collapse of the right lung, because obviously the middle lobe is present only for right lung, right? So right middle lobe collapse, the hilum is in normal position. Okay, in all the types of collapses, the hilar position will alter. So first we should learn the position of hilum. Normally, this is the hilum. Okay, so if you see, the left hilum is at higher level than the right hilum in 95% of cases. Left hilum is almost at the equal level of that of right hilum in 5%. So if you draw a line, see, this is left hilum. This is where you are seeing the right hilum. So left hilum is higher than the right hilum normally as shown in this figure. Now if you see here in the normal hilum, if you see the normal hilum, in the lower lobe you can trace this bigger artery, even here bigger artery. What is this? This is actually right lower pulmonary artery. Sometimes this right lower pulmonary artery is visible or is seen like a little finger, right? It is seen like a little finger. So this is one thing which you should keep in mind. Next important thing is about the lobar collapse. Okay, in the lobar collapse, the most common type of this lobar collapse is actually an obstructive type of collapse. Okay, now what actually happens is, first and foremost, if this is the lung, normal lung, okay, this is the normal lung. Here we have the heart, okay, which is seen like this. Okay, perfect. Now think that there is a collapse. So collapse is, okay, if there is a collapse here, whatever the reason is, this part of lung has been lost. Okay, so this volume is lost. So because this part of lung volume is lost, you will see that, okay, for easier thing, we will say that this whole lung is lost. For our easier comparison, we can say that this whole lung is lost. Okay, in such cases, what happens? If this whole lung is lost, one thing that happens is this whole part will get contracted. That means, number one, there will be all the ribs which are present here. These ribs, because of the loss of volume, these ribs will appear to be crowded. It's better to draw ribs like this, right? Okay. These ribs will now appear to be crowded. Okay. So you are seeing number one, crowded ribs. Okay. Number two, this dome of diaphragm will get elevated. Okay. Number two, the dome of diaphragm, sorry, right. This dome of diaphragm will get elevated. Okay. So number two, you see elevated dome of diaphragm. Number three, you will see that there is displacement of the hila. Okay, this hila and everything will get displaced to this side. Okay, number two, number three. So there is hilar or trachea or mediastinum. Displacement is seen ipsilaterally towards the same side. It displaces. Okay, next there is, these are actually the signs of volume loss. Crowding of ribs, elevated right dome of diaphragm, and hilar or tracheal or mediastinal displacement. Similarly, there can be hyperlucency or hyperinflation actually. Hyperinflation of opposite lung is seen. So in this lung, you will see hyperinflation changes. That means you will see that this lung becomes bigger. Okay, and the mediastinum is pulled here, this side. So this lung will look a lot more bigger like this. Okay, next you will see that there is increased hypertransradiancy or increased blackness. That is, you can see that there is hypertransradiancy, sorry, transradiancy. That means there is increased blackness. In our words, we can say that there is increased blackness in this part of lobe. And you will also see that the vessels which are present inside, they are also widely arranged. Okay, vessels are also widely separated. And vessels, so vessels are widely separated. And one more important thing is ribs are also increased, spacing is present between the ribs also. You will also see that there is increased spacing between the ribs. So 1 rib, 2, 3, 5. You will see increased spacing between the ribs. Okay, so this is how you can diagnose the collapse. Okay, so if you see the picture here, okay, if you see the picture here, this is a picture of lobar collapse. So if you see here, there is this lobe is collapsed. So as a result, the this here there is increased overinflation of this lower lobe of the lung is seen, and as a result, the bronchoscopy markings or the vascularity is seen, the vessels are seen to be separated more from each other, whereas here they are less separated from each other, and this lung is bigger, so because of this overinflation. Similarly, if you see the crowding, here you will see crowding of ribs, that is the rib space between, the space between two ribs will be less here, and here the space between two ribs will be more. So these are the general features of collapse. Now, in the next class, we will see how the right lung collapses. From each one to one lobe, we will look at it. Thank you.